Dear students, welcome back. In the previous session, we have discussed about medial aspect of the thigh. Now, in this session, we are going to discuss about gluteal region. So, the gluteal region overlies the side and back of the pelvis, which is extending from the iliac crest above to the gluteal fold below. This region is called as gluteal region. The lower part of the gluteal region, which presents a rounded bulge due to excessive amount of subcutaneous fat known as buttock. Okay, the anterior superior part of the region seen in a side view is called as hip. The muscles, nerves and vessels emerging from pelvis are covered by gluteus maximus and buttock. So morphologically, the erect posture of man has led to extension at the hip joint and appearance a gluteal fold, which is a transverse skin crease of the hip joint. So this puts greater responsibility on gluteus maximus muscle, which makes the body erect and maintains it in erect posture at the hip. This involves raising and supporting the trunk against gravity. The gluteus maximus covering the hip joint is therefore one of the most powerful and bulkiest muscles in man. Okay, if you see this gluteal region boundaries, medially it is having the sacrum and the coccyx. Laterally, the side of the junctional area of the abdomen and thigh. Superiorly, you'll have the iliac crest, and inferiorly the deep horizontal furrow of the transverse gluteal fold. Okay, actually it is a transitional region between the back of trunk and back of thigh. Now we will move on to the surface landmarks. So in the surface landmarks, we can find the iliac crest. So whole length including the anterior superior iliac spine, the tubercle of iliac crest and posterior superior iliac spine. So altogether we can palpate on the gluteal region, and this one is the gluteal tuberosity, and we can palpate fourth lumbar and second sacral spines. So fourth lumbar and second sacral spines. We can also palpate the greater trochanter. Okay, so these are the important landmarks we can see on the gluteal region. Now we will see the next layer, that is the superficial fascia. Okay, yes. So the superficial fascia is heavily laden with fat, and which is more in females and is tough and stringy over the ischial tuberosity. So normally we can find the ischial tuberosity at this level. Okay, so where it forms an efficient cushion for supporting the body weight in sitting posture, and also it contains cutaneous nerves, vessels and lymphatics. So here we can see the cutaneous nerves and also the root values of these nerves. So here the gluteal region is divided into 4 quadrants. So upper medial and lateral, so upper medial and lateral, and lower medial and lateral. Okay, so now we can see the cutaneous branches. Now the upper and the anterior part is supplied by the lateral cutaneous branches of the subcostal T12 and L1. So these are normally the iliohypogastric nerves. here this lateral branch is somewhat placed anteriorly, so we can consider this one as upper and anterior part. Okay, and in the upper and posterior part, which is supplied by the posterior primary rami of spinal nerves L1, L2 and L3. And if you see, the lower and anterior part is supplied by the branches from the posterior division of the cutaneous nerve of thigh. These are L2 and L3. And the lower and posterior part, which is supplied by branches from posterior cutaneous nerve of the thigh and the perforating cutaneous nerve, that is S2 and S3. The root values are S1, S2 and S3. So these are the cutaneous vessels which supply the skin of the gluteal region. If you see the vessels, the blood supply of the skin and the subcutaneous tissue is derived from branches of the superior and inferior gluteal arteries. Normally, the lymphatics from the gluteal region drain into lateral group of the superficial inguinal lymph nodes. Okay, if you can see the deep fascia of the gluteal region, the deep fascia above and in front of the gluteus maximus, that is over the gluteus medius, which is thick, dense, opaque and pearly white in color. So over the gluteus maximus, however, it is thin and transparent. The deep fascia splits and encloses the gluteus maximus muscle. So this is about the deep fascia as well as the superficial fascia. In the next session, we are going to discuss about the muscles which are related to the gluteal region. Thank you.